Have a conversation about vaginal estrogen. As a pelvic floor PT, I cannot prescribe vaginal estrogen, but I can definitely recognize when somebody needs it. And so lots of times when I'm seeing moms in those early postpartum weeks, we can look at the tissue, but also listen to the symptoms. Usually if there are superficial symptoms, meaning tenderness to light touch or irritation, dryness, those sorts of things. And again, those first postpartum weeks, the estrogen has dropped significantly. Those can be really clear reasons to get a prescription, and it's getting better. I don't get as much pushback from physicians, but I had a client recently, lots of pushbacks. We eventually got the prescription, and this person I was working with for high tone pelvic floor. So in that context, I don't want her brain to be freaking out that that area is painful and then kind of reflexively guard muscle wise against that pain. So lots of times I'll have them start for a couple weeks on vaginal estrogen before we do any internal work, just to make sure that that doesn't happen. And so this person saw her OB. Her OB's like, oh, well, with sex, you just have to force your way through it. It's like aversion therapy. Just keep doing it until you don't mind it anymore. I'm like, yeah, no, we don't do that, especially if there's a hormonal deficiency, which again, really common. We're starting to coin the term genitourinary syndrome of lactation. And we can have some urinary symptoms with that, painful sex, all those sorts of things. And when somebody's telling me after your vaginal assessment, sorry, the dog's going everywhere, after vaginal assessment, internal assessment, it's sensitive afterwards, or after using a wand it's sensitive, or after sex it's super sensitive and irritated, let's pause on those things till we start using the estrogen cream for a couple of weeks, and it's local so it doesn't impact milk supply, which is fantastic. Let's start doing that and then try again. Like, let's not keep banging our head against a wall and forcing it because, oh, it's just aversion therapy. No, that's training your brain to be like, no, keep protecting this because this hurts and it sucks and you don't want to do it. So I think for those of us in this space that we cannot prescribe this, but we can definitely recognize when it's needed. We need to keep pushing our moms that if they are working with providers who are hesitant to prescribe it, and we have really good reason for it, to either have a conversation with that provider that can prescribe it, or there's a lot of online companies here now in the US that will do a telehealth visit, and they're very familiar with prescription in early postpartum weeks to be able to get that. But again, like, it's like, I'm not going to refer to PT. Like, what it's like, is this crack cocaine? Like, are we controlled substances at this point? Like, same thing with vaginal estrogen. If you want to know more about vaginal estrogen, some of the loud voices in this area, Ashley Winter, Rachel Rubin, we've had podcasts with both of them to chat about that. DM me and I'm happy to send you the links to those episodes. But yeah, we can't be gatekeeping this anymore, and we have to recognize as providers when we need to push our patients a little bit so that we can do our jobs too. So if you've been trying to get vaginal estrogen and you're having trouble, DM me, let me know. If you are working with a provider, whether it's PT or otherwise, or you're a provider and trying to figure this stuff out, let me know.